This is Detroit's Morning Answer with John Anthony on FM 92.7 and AM 1400. The Answer.
If that counterproposal was enacted, is illegal aliens would be paid for. American taxpayers, hard-earned dollars, would be paying for benefits for illegal aliens again. We're not doing that.
But it's against federal law for people who are here illegally to get health
and that's
care.
why our reforms are so important to enforce all that. What the important thing to remember is what's happening
I didn't see that the
tonight.
Democratic proposal that people who are here illegally
No,
should get health care.
because they don't have the level of specification that we had in our bill. It will unwind that, and all those things that the CBO just verified will be reversed. We can't afford to do that.
But you see my point, that there's
no, I
nuance
don't
in
see
the
your
argument
point.
that you're
No.
making, right?
No, that is a red herring in this debate. What they've decided to do tonight with their vote is to close the government. And what that means, everybody needs to understand, real pain for real Americans. What does that mean? It means women, infants, and children do not get their nutrition programs. That is not funded anymore. Veterans don't get their health care services, suicide prevention, and other very important things that are very timely. You have low-income persons who are Medicaid, Medicare recipients who are receiving care at home. Those programs are now lapsed. They will not be funded.
Yeah, you're making a point about what
paid,
happens if the
TSA
government
agents
shuts
That's
down.
right, and they just decided to do it. So the only question tonight is, how long will Chuck Schumer keep the government closed? It's a dangerous gambit. It's something that he himself said his entire political career would be dangerous and disastrous. Roll the tape. We're rolling the greatest hits on our social media.
Yeah, I'm just saying that.
Well, I went back down memory lane with Schumer, Reid, Senator Warren, and others. Who were and the Bernie bro, Bernie Sanders, Senator Bernie Sanders, they're talking about what happens with how they just despise government shutdown. That was Speaker Mike Johnson discussing the vote that went down, and Democrats, except I believe all but 3 U.S. senators voted for it. So joining me today to discuss this is Gabrielle Minarik. She's the program manager at the Paragon Health Institute, where she advances free market healthcare solutions. With over 5 years of federal health policy experience, Gabrielle has advised top biopharma and healthcare organizations at Todd Strategy Group and earlier worked at Farragut Square Group, where she provided private equity firms with strategic insights on healthcare deals, acquisitions, and policy shifts. So she knows what she's talking about. Today, she joins us to discuss Vice President J.D. Vance warning that Democrats are seeking to repeal the health provisions of the One Big Beautiful Bill. Reforms designed to preserve Medicaid for the elderly, the disabled, pregnant women, and children who truly need it. Gabrielle, I don't know how you want me to address you, Gabrielle or Ellie. Welcome to Detroit's Morning Answer.
Well, thank you for having me on.
L is fine?
Yeah.
Okay, that works for me. So when you first you saw J.D. Vance, he put out the tweet basically saying they're going to stop this bill from this clean continuing resolution from passing, all to protect illegal immigrants. Is that a true statement? I mean, you heard the reporter. I mean, not once did she try to discount what those who are from Chuck Schumer and all those, what they're saying. She just continuously tried to bat down Speaker Mike Johnson. Is that a true statement that that's what's going to happen when as the government has shut down as of 12:01 a.m. this morning?
Well, you know what? Vice President Vance is 100%. And, you know, that CNN reporter played right against Democrats they've been doing trying to do for a while. Try to cower behind federal law.
Yeah.
And pretend they're not using federal law and all of these different loopholes that they create to provide health care. You know, by repealing
you're breaking up really bad. I don't know what's I don't know if you're on the speakerphone, but it's breaking up really, really bad.
Okay.
Let's see.
Try now. Can you hear me better?
No, there he is. I can hear you.
Awesome. Apologies for that.
No, that's okay.
What I was going to say is that, you know, Vice President J.D. Vance is 100% correct. And what that CNN reporter was doing was playing right into what Democrats want and the game that they play. They like to hide behind federal law and pretend that they have not set up several loopholes for illegal immigrants to be receiving health care in the United States. And rightfully, Republicans in the One Big Beautiful Bill took several steps to restore federal law back to its original intent and close these loopholes that have been allowing Medicaid for illegal immigrants. For an example, when you're an undocumented immigrant in the United States, before the One Big Beautiful Bill, you were able to get access to emergency Medicaid, essentially giving them free health services, and the state was able to invoice the federal government to cover those services. In an egregious example, you have the state of California that uses really dense and very complicated Medicaid financing formulas that Paragon refers to as Medicaid money laundering to draw down over $10 billion in extra federal funds without putting up a single state dollar, which then they turned around to use and spent over $4 billion on free health care to illegal immigrants in the state.
Wow. You know, as I went through your article at Paragon, I'm looking at all of these sections that was a part of the Big Beautiful Bill. But Section 71109. Now, I'm still trying to figure out what's the opposition to this. Section 1109. This is what it requires: citizenship or immigration verification before federal funds flow. Why is this safeguard so central? And what is the real world risk if Democrats repeal this?
Sure. So, exactly what you're asking me. When there is a, illegal alien that is in the United States and is pending proceedings to become a lawful citizen, essentially what happened was they would automatically be eligible for free Medicaid benefits at the enhanced match rate for able-bodied working age adults. That's also something that we tried to get at in the One Big Beautiful Bill. Yeah. And that really just shows, this is Democrats' priorities hiding behind federal law to try and stand up their long-leaning, left-leaning priorities on free health care for illegal immigrants. And so they're upset about this provision of the bill because it ends that gravy train for blue states that have been giving free Medicaid to illegal immigrants, which, is crowding out resources for what Medicaid is really intended for, which is intended for our most indigent, the elderly, the disabled, pregnant women and children. When we don't have the majority of our resources being routed to those folks and instead being routed to emergency Medicaid for illegal immigrants, you're quite literally taking dollars out of their pocket and taking health care away from true American citizens that are most vulnerable and need it.
Now, during COVID, over 20 million people, because the enrollment, I should say, ballooned to over 20 million people. And then when you think about Medicaid and in these what they call the improper payments, I mean, they've been estimated at nearly $100 billion annually. I mean, more than the budgets of many of our federal agencies. How does the One Big Beautiful Bill take a meaningful bite out of that waste? And I that's where I think a lot of them, especially the illegal immigrants, were able to get onto the rolls was during COVID.
Well, exactly. And that is a strategy that the Biden administration and Democrats have been using for a long time. We refer to it as enrollment at any cost. So what the One Big Beautiful Bill does is it comes in and it really adds a lot of verification requirements. It reinforces previous incentives/requirements of the states to make sure that they don't have high improper payment rates. But, just under 4 years under President Biden, without any legislation, just simply talking about executive action, we saw the Medicaid program spending increase by over $1 trillion in 4 years. That is not through bills that our elected representatives here, in the House or in the Senate, voted and worked on and negotiated together. That was simply executive action done by political appointees of the Biden administration. And so the One Big Beautiful Bill is really restoring integrity back into the Medicaid program and reorienting it for the people that deserve it the most.
Now, I want to go just read down a couple of the sections that were addressed. Section 1103, the double dipping, where it addresses the duplicate enrollments across states. Section 71104 and Section 71105. it requires states to remove deceased individuals and providers from Medicaid rolls. I remember when I was a state rep, we had a state rep named Patty Belloc who actually tried to do that. And, guess what happened? It stopped. And then you have Section 71106. It limits HHS waivers on improper payment thresholds. Section 71107. I mean, this is the point I'm getting at. It looks as if the Republicans are trying to get at the gist of the problem and solve it, whereas the Democrats don't want it because this is part of, I guess, they think their new voter rolls. I mean, I don't get it. Help me and help the listeners who are listening. How does what the Republicans are doing actually trying to help the taxpayer?
Correct. Well, we're trying to make sure that your taxpayer dollars are actually being routed to those who need it most. And it's trying to end this long relationship with Democrats where they are in bed with corporate interests. For too long, they've been entrenched by corporate welfare, in bed with insurance companies, and they are really simply trying to expand these government programs so large to where we basically have pseudo-socialized health insurance. If you make Medicaid so big, if you make the Affordable Care Act so big, you crowd out all of the private insurance that is truly affordable and helping you with your health care. And so they do that by inflating these federal programs. You know, you mentioned Medicaid waivers. Medicaid waivers are supposed to be able to allow states to use targeted funds to help folks in their states that need it most. But Democrats really abused this program, and it ballooned to where almost 50% of Medicaid spending was coming from these waivers. And these waivers aren't just on health insurance and trying to make it more affordable for American citizens, but they're on things like paying people's rent or paying for their air conditioning, because, you know, they're trying to talk about social determinants of health and how that's somehow supposed to be health care. There were some waivers that were giving cell phones to undocumented immigrants in the U.S. through their Medicaid program.
Wow.
And so you're right. Republicans are trying to use, did pass the One Big Beautiful Bill to really safeguard this program and safeguard this lifeline for truly indigent Americans, and stop Democrats from abusing it and expanding it way beyond its scope. And so right now what they are trying to do is hinge government shutdown on reversing all of these amazing provisions that really reorient the Medicaid program back to who truly needs it. Like I said, elderly, the disabled, pregnant women. The more money we spend on illegal immigrants, the less money that is going to them. And that is a complete moral decision that we need to make and uphold, because American citizens need to come first.
Amen. If you're just joining the show, we're talking to Gabrielle Minarik. She's the program manager at Paragon Health Institute. Now, there was a section that drew my attention as it relates to state-directed payments, Section 7116. It caps state-directed payments relative to Medicare rates. Here's my question. Why peg Medicaid to Medicare? And what chaos results if Democrats are able to lift that cap?
Sure. So the Biden administration actually lifted that cap, and they said that state-directed payments, which are essentially these bonus payments that states give to providers in the state, and as a way to pay them back for taxes that were levied on them so that they could get more money from the federal government through their Medicaid reimbursement. And so it's really important that that is capped. That cap was removed by the Biden administration, and it allowed these special payments that have barely any oversight for the American taxpayer that went up to average commercial rates. Now, average commercial rates are 2 to 3 times that what we are paying in the Medicare program, which in simple terms means that for an able-bodied working age adult in the Medicaid program that could, be out getting a job, trying to improve their life, they were getting paid 3 times for any care rendered to them than what we were paying for a senior in the Medicare program.
Yeah,
So if you don't have a cap on that, it's just going to lead to infinite federal spending, and states are just going to continue to route hardworking tax dollars to these corporate interests like hospitals and insurance companies that does not lead to better care for you, the American taxpayer that's financing this.
Yeah, according to some numbers here in Michigan, Michigan projects that over 700,000 Michiganders, including children, seniors, new moms, people with disabilities, veterans, and rural communities, could lose Medicaid coverage under these proposed federal cuts that the Republicans are. But here's what I want to know. How are they able to come up with these numbers? And is that a true assessment of what actually will happen with the Republican plan on this clean continuing resolution?
No, that is not what's going to happen under the plan on the CR, because the CR is just going to take government levels and take them exactly where they are right now. Now, what they're talking about with that number is trying to get at the one big beautiful bill Medicaid provision. And I am here to disprove that statistic right now. What the one big beautiful bill does is impose a very modest community engagement requirement, but that only applies to able-bodied, working-age adults in the program.
Thank you.
Pregnant women, the disabled, they are protected, and they are not having those requirements placed on them. They are not going to lose their Medicaid coverage.
Well, I posed it that way because this is what is being out there. This is as I'm from Chicago, and they said this is what's on the streets right now. People are believing these things, and I keep trying to tell people, stop believing the lies. This is all about illegals and able-bodied people who can go out there, get a job, and get their own insurance to provide for themselves. It is not going to go after the most vulnerable. That's why it was created, Ellie.
Yeah, it is why it's created, and that's what Republicans and conservatives in the One Big Beautiful Bill were trying to reorient Medicaid back to. There's still more work to be done, but this is a historic amount of reform that is truly going to reshore and give us more resources to invest in the most vulnerable. And regardless of Democratic lies, when you are doing the right thing, you have to defend it with everything you have, and that's what we are doing right now, because Democrats would rather peddle lies to protect illegal immigrants on the program and instead let the most vulnerable pay the price.
Well, here's the framing. I believe what's happening. Democrats want to call this repeal expansion, while Republicans call it erosion. In your view, how much of this is a messaging war, and how much is genuine policy divide?
I think it is a large messaging war. I think that they are trying to other us. They are trying to say that we are not compassionate. And so, I think that comes down to the policy level, too. Like I said, I think Democrats really want there to be enrollment at any cost. They want as many people as possible on these government programs, which, is getting at your tax dollars. And Republicans believe that if American taxpayers are going to be financing free health care for Americans, that they should be American citizens, and that should be targeted towards the most vulnerable. And so at the end of the day, they want to make this a messaging war to try and make it seem immoral. But as I said, we are doing the right thing. We are protecting this program for those who need it most. And regardless of the messaging war, that is the right thing to do. And Republicans have every right to go on the offense on this and disprove all of the lies that are coming out of Democrats.
Now, Ellie, you've worked in both private equity health care and federal policy. How do markets respond to uncertainty like this? Does this repeal risk freeze investments, or does it create incentives for bad actors?
There's a lot of incentives that can come for bad actors in this. We absolutely saw that in the Medicaid program, and that's why we clamped down on the Medicaid money laundering apparatus and why we're cracking down on verification and variability. When you set up incentives in the government to say, we're not going to check if you're actually eligible for this program, it does send market signals out that they should look into investments that push the line. Republicans are putting safeguards back in place to reorient those incentives to make sure that investment is going into the right place and not just trying to get at your tax dollars.
I got two final questions for you. One is in the One Big Beautiful Bill, which reform is the sleeper win that no one is talking about yet? And the second question is, if you had to explain the health title of the One Big Beautiful Bill in one or two sentences at a kitchen table in Michigan, what would you say?
Sure. So I think the first sleeper win is going to be that we massively expanded health savings accounts. And what health saving accounts let you do is take your dollars, your hard-working money, and take it pre-tax, where it lowers your overall taxable income, and you're then able to use that money that's set aside in that account for health services that you choose. And one of those expansions allows you to use your health savings account dollars on what's called direct primary care. And what direct primary care is it's very discounted primary care that's very affordable that you have control over. It allows you to enter into an agreement that's a small monthly fee and then receive primary care from great doctors at a local level for free. You have better coordination, which we've seen data that's showing that this is really good for your health. So it's empowering primary care and allowing you to use your hard-earned money pre-tax to be able to tackle some of these healthcare costs.
I love it.
Ultimately, at the end of the day, what the One Big Beautiful Bill and the health title boils down to is expanding your healthcare freedom by allowing you to use your hard-earned money on your healthcare services and receive tax benefits for that. And then it reorients our federal programs, specifically Medicaid, back on those who deserve it most, which is most vulnerable, disabled, pregnant women, seniors on the program, children that are very indigent and have low income. And it does that by getting at the Medicaid money laundering apparatus, which has just been sending tens of billions of dollars to insurance companies, and really make sure that our Medicaid benefits and Medicare and the ACA are only available to legal American citizens and are no longer exploiting government loopholes that provided that to undocumented and illegal aliens in the U.S.
I love it. Gabrielle, we got to leave it there. That's Gabrielle Minarik, Program Manager at Paragon Health Institute. You definitely will be somebody that I put in lock-in to come on to discuss these issues because I truly, and thoroughly enjoyed our conversation today.
Well, thank you so much for having me on. I look forward to more riveting discussion.
Let's do it. That's Gabrielle Minarik. Thanks so much for joining us. Paul, broke it down. Excuse me. I got to stop drinking coffee when I'm talking on the radio. Broke it down in just layman terms where a fifth grader could understand. And, just the lies of what so many people are saying. Paul, there were sections I didn't even get to with her as it related to this One Big Beautiful Bill. And I read the bill when it came out. I advise people to actually read what's in it before you believe what the media is saying and what those who are on the left are saying about the bill. Trump is putting America's financial situation on target, and he's fixing it, folks. We'll be right back.